Someone described to me once the difference between upstream and downstream interventions in the healthcare field. And they told the story about this group of people were walking along a river, and all of a sudden they saw a baby floating down the river. So they rush into the river and grab the baby. And then they turn around, here's another baby coming, another baby coming, and all the people along the river are rushing in to save the babies coming down the river. And this one guy starts walking away, and they say, "What are you doing, you jerk? You're supposed to be helping us save the babies." And he says, "I'm going upstream to figure out who's throwing those babies in the water." And I thought that was a great example, illustrating why community development corporations are focused on upstream as opposed to a downstream approach to community health.
If we look at how we spend our money on healthcare, about 96% of our resources are spent on clinical or medical care, and only 4% is spent on prevention. And so it's really critical that we flip that equation and start to dedicate more resources to community health and to lifestyle and risk factor reductions.
Thinking about the river analogy, it's really important for us to stop the metaphorical babies from falling in the river in the first place. For example, if we promote healthy housing that reduces asthma triggers such as mold and pests, we can reduce preventable hospitalization as well as reduce asthma rates.
I think I started appreciating how housing impacted health when I was an intern, and I admitted a child to the ICU with asthma. And if you've ever seen a kid with asthma, they are just so scary, right? They're breathing, they're sucking, you're worried about whether you're gonna have to put a tube down their throat. And the family talked about the fact they had gotten a cat recently, and I was kind of mystified. I'd read in her chart she was allergic to cats. And all of a sudden I said, "Well, why did you get a cat?" And they said, "Well, we found a mouse in her bed." And the landlord wouldn't listen to us, and we needed to get rid of the mice. And so to me, it was this eureka moment where no amount of medicine I was going to give that kid was going to make it okay for her to go home. And the prescription I wanted to write was a healthy house, being able to work with housers, to work with community groups, to work with making the communities that your patients live in healthier is a natural next transition.
Really what community development corporations need to demonstrate is that the work that we're doing has always addressed the social determinants of health. So in some ways, to work with this new partnership in the health community, we need to just rebrand what we're doing.
So the social determinants of health is really something we're paying more attention to, and those are the conditions in a person's life that gives them opportunity to be more or less healthy.
Some of those health determinants that we talk a lot about because they really are very impactful are things like access to safe, clean, and affordable housing, neighborhoods that are safe so you can actually walk in them and feel comfortable walking in them, and neighborhoods are not only safe, but maybe they actually have sidewalks too, and they have access to public transit, and they have enough vitality in them that there's actually opportunities for jobs.
And if prevention is driven by these community level determinants, access to open space for physical activity, a working, not broken food system, access to healthy foods in that food system, that's health. I'm not asking community development corporations to measure blood pressure or take height and weight and BMI. They can simply do what they're doing, but understand and put it under the banner of community health.
So recognizing the importance that your zip code can have for your health, we decided to do a project looking at how community development and health were linked. And that project is the Community Investment Tax Credit Health Impact Assessment, or CITC-HIA.
The Community Investment Tax Credit Program is a really exciting new initiative that provides state credits to private investors who invest their funds in certified community development corporations. So it's really a way to bring in more support for our excellent community development corporations in Massachusetts. And those private donors get a tax credit, 50% on their tax liability.
We divided community development corporation activities into 4 categories. In the physical development and community planning pathway, CDCs can work on developing healthy and affordable housing. In the economic development pathway, CDCs can do small business development. Asset development we defined as investments in the individual. So this could, for example, include English as a second language classes. In the community organizing, building, and empowerment pathway, CDCs can do something like bringing community meetings together.
So one particular pathway we looked at was the physical environment that's being constructed, so buildings, roads, parks, and open spaces. Among that too, looking at transportation and facilities like sidewalks and bike paths and how they develop potential roads and transit in their neighborhoods.
So for example, we recently built a 43-unit single-room occupancy building that serves mostly extremely low-income individuals. It's a healthy building with no toxins in the paint. It's got good ventilation, good insulation, so people are living in a better quality housing unit to begin with. The other thing that we've done is work with the police department to reduce crime in the neighborhoods with things that are as simple as better property management and some of the housing, addressing blight by coming down stricter on some codes in certain communities. We've also been able to work with the Parks and Rec department to invest in improvements in the green spaces that are located in our communities.
In the category of community organizing, leadership development, and community empowerment, this was a category that really came out of our conversations with community development corporations, an activity that they like to invest in but doesn't always necessarily get the investment that it needs. But when we look at this category, what we find is that it's really connected to setting that sustainable direction for a community. So things like how much people are volunteering in a particular neighborhood, how many people are participating in civic events like voting, or even just public events in a particular neighborhood. And we looked at that has correlations to social cohesion and whether or not someone feels comfortable in their community, they don't end up being isolated from their community, and ultimately looking at what type of impacts that has on social stresses and mental health, and even issues like domestic violence and street crime that may occur as you have more people out and more people taking pride in a particular neighborhood and what's going on.
The community developers have an expertise in creating space, facilitating community meetings, and really engaging the community in a way that will get them to the place. We're already connected. And out here, we've rehabilitated a number of the facilities in the community that we would have these meetings at. Where I think public health can partner in that is to provide the expertise to the folks who attend. But the CDCs can really create the space in the community for that to happen. It has to be efficient, it has to be done in a way that's convenient and accessible. It just can't be done in silos. You know, we have to work together to do it.
The way I would envision a CDC partnering with the health department might be to give us a call and say, we're thinking about developing this project, and here's what that scope might look like. And we'd like some advice on what are the right health outcomes to look at. Is there anything else we need to know about this particular area? Our staff are really, really helpful in terms of trying to help somebody think through a process.
Well, I think there's a great opportunity with the Affordable Care Act now being implemented here in Massachusetts, that there's an opportunity for our community development corporations through the Community Investment Tax Credit program and help enabling that to forge greater alliances between those in the healthcare field and our CDCs.
I think CDCs need to do a couple of things to better communicate with the health sector and to build those partnerships. I mean, first of all, they have to become familiar with the research and the studies that document the connection. And they don't have to know every statistic and they don't have to be able to rattle off every number, but they need to know the general thrust of that research. And number two, they need to forge relationships. They need to go and have lunch with people. They need to go and have a cup of coffee with somebody. One of the simple suggestions I heard recently is if you don't have a health professional on your board as a CDC, you should go get one, whether it's the local community health center or somebody from the local hospital, because immediately that will begin to help open some doors and open up some relationships.
I think the notion of breaking down silos and breaking down sectors among all of the various areas of expertise that in fact are attempting to provide service to lower income communities or lower income people is a really important outcome.
Recognizing that there's this underlying shared concern around how to deal with poverty on a systemic level and through some of the social determinants that are affecting how people are going and using the health center, how people are when they're in our housing, we think there could be some really unique ways to deepen our partnerships and address that on a more comprehensive approach.
HIA is one way to get us there, and it's one way to get us there because it provides a really concrete example of a specific issue that's being looked at and takes you through an evidence-based process to really spell out from point A to point B what the health outcomes and the health impacts would be from making the decision that's on the table.
It's going to be an important way to measure our success and measure our progress. Again, it's not just about creating new units of affordable housing or how many jobs we create. It's about improving the overall quality of life and the health outcomes of low and moderate income residents in our neighborhoods across the state. And I think these assessments are going to be a crucial tool for measuring that.
My dream is that public health advocates and community developers can come together to advocate that a greater portion of resources go toward addressing the social determinants of health so that we can have healthier people and better neighborhoods.
We're looking to go further upstream and really address those issues that drive the health outcomes that people get to enjoy. So now is the perfect time for the work around public health and community development activities to get better aligned so that we can push further forward, hit people where they are, their homes, their neighborhoods, where they work. And overall, what we can look for is healthier and more resilient communities across the Commonwealth.